All right, 3, 2, 1. What's good, everyone? How y'all doing? I got a superhero crew of osteopathic physicians. This is amazing. Dr. Jen Caudle, thank you so much for jumping on. Dr. Tyeese Gaines, Dr. Tyree Winters, what's up? Welcome to Docs Outside the Box. How y'all doing?
Doing good.
Good.
So I call y'all my super team because y'all literally are superheroes. Y'all doing amazing things, both inside the hospital and outside of the hospital. And, I know y'all are busy, so I just want to say thank you very much for jumping on this. But obviously things had just blown up earlier this week and into last week that I was like, we got to talk about this. You know what I'm saying? The only way we know how to on Docs Outside the Box as a topic outside the box. So I want to get y'all on here and talk about your opinions because y'all are doing great things as osteopathic physicians. So with that being said, last week, obviously, the commander-in-chief acquired COVID-19. We ain't gonna go too much into that, right? But that's an entire whole thing we can talk about. But acquired COVID-19, got sent over to Walter Reed. And just like any other major situation that happens, the physicians come out, they come in their whole little, formation and so forth. But I guess the head physician is Sean Conley. He's an osteopathic physician who was trained, I believe, at Lake Erie College of Osteopathic Medicine. And,
Pennsylvania. PCOM.
He's Philadelphia College of Osteopathic Medicine? Okay. And I think it was very visible, his name, as well as his credentials. And there are some questionable things as to when the president developed symptoms, just some things that in general, people were just like, that's not making sense. And then I think when people started to look up this gentleman's credentials, then they started putting 1 + 1 to make 4, and then started taking all of these different things and taking pot shots at the osteopathic physician profession, which we know is not warranted. So what are your thoughts on all this? Who wants to go first? I'm going to throw it up as a jump ball, and then we're going to just kind of take this where this goes. Let's go, Dr. Jen. What do you think?
Well, so I saw the New York Times article that came out, and there was a New York Times article that was talking about the medical team and kind of going through that. And in particular was talking about Dr. Conley, and they made a number of statements that I found factually incorrect about DOs and osteopathic physicians and even the osteopathic medicine profession. And I guess I was disappointed and I was saddened, and it in my opinion, it just did so much damage. Like, when words are out there, as much as we can go back and we can fight them, we can retract, we can correct, those words are out there, and it's the New York Times, which I subscribe to, I read on a daily basis. So I was really disappointed, especially given this day and age, we're finding information.
The New York Times is an institution.
It really is. It really is. And in this day and age, it's not that hard to find information. I mean, the New York Times has some of the best, the best journalists in the world. And, with a quick Google search, you can actually find out what a DO is and what a DO is not. So I was disappointed and I'm frustrated.
I was looking at Rachel Maddow even got caught up in this. And Rachel Maddow can take any story and start all the way literally from like the time Jesus was born and try to make it connect from here, there, and all that stuff and do all this research. And she got it wrong. She still hasn't retracted her statement yet, I don't think. But Dr. Tyeese, what do you think?
I'm walking through the stages of grief, I think. I was very angry a couple of days ago. Pretty fired up, actually, because it's just like Dr. Jen said, it's so simple to just look things up now, right? Like a simple Google search would have solved this. I was disappointed from the voices that it was coming from: CNN, MSNBC, New York Times. Like, we're not talking about some of these like spin-off websites that somebody created in their basement. We're talking about journalists. So that coming from me being a journalist, I have a master's in journalism. I did news for almost 20 years. That alone was disappointing. Then there's the other side of actually being a DO and just watching the comments beneath some of these posts or after some of these things aired. I mean, like,
straight
we were just being dragged.
Yeah.
And I was just like, what did we ever do to you? Like, it was really, really disappointing. And, we all work very hard. I understand that the general public may not be completely schools on what exactly the differences are or the similarities are between DO and MD, but it just went so negative so fast that I was just like, whoa, like what? Like there wasn't even a moment of like, what is a DO? That's interesting. It went straight to, he's not even a real doctor. What are these folks? And then even the articles that tried to explain it, things like, oh, osteopathic physicians are generalists. And you can be, a primary care physician, but we are all, most of us have that practice. We all are board certified in a specialty, even if it is a primary care specialty. So that's another misconception. And so, I mean, we can definitely, we can talk more about my anger, but I was disappointed across the board.
Bring that anger out. Sure. Bring that anger out. Like, so I got a tweet here. That's what I'm looking at with my phone. So there's a tweet here from Lawrence O'Donnell. And it says, how many times will Trump's doctor, who is actually not an MD, have to change his statements? And it was just like, dag, like, bro, like, what is, like, it was almost like they were trying to be punitive in nature. And then once they found out that he wasn't an MD, it was just like, oh, that makes sense. And then that's why I said 1 + 1 would be equal to 4. And it's like, that part I didn't really understand. Like you said, was like the vitriol of not finding out that he's an allopathic physician, not understanding what type of physician he is, and then just using that as a reason as to why you're questioning why you have so many issues with the timeliness of when they're updating on the president's health, or all these things that don't make sense. That's not related to his credentials at all, actually. That's just related to the doctor in general. So, Dr. Tyree, jump in on this, man. What you think?
Well, you know what? I'm not surprised by one means, because if we want to really go back into history and think about this, most recently we had to deal with David Gergen, who had something to say about CNN before, who had questioned the Dr. Conley's degree at that time of being a DO. Biggest thing is that
this is recently or way back?
Yeah, it was a few months ago.
Yeah,
a couple months ago, maybe.
About a month, a few months, almost to a year ago, I want to say. And the thing is that because this came about when Trump's health, when his physical was done.
Yep.
And it was right around the time that we were starting the election cycle that was going on. He had a physical that was done. Dr. Conley had stated that Trump was in excellent health besides a little bit of cholesterol issues, which we all know phenotypically he is demonstrating obesity at its finest. However, this is what was said. There was questions that were being made about whether or not his physician was being accurate with his statements or was being kind of allowing this gaslighting that Trump is so used to doing. And that's when David Gergen said, well, he's just an osteopath. First and foremost, if we go further back in history, we know...
Wait, if you don't mind me interrupting, David Gergen actually did this again a couple months ago. See, I didn't know about that first time. He did it a few months ago. It was during COVID. And I tweeted, and a few other people tweeted, he actually issued an apology. So he's done that more than once, apparently. I didn't know about the time in 2016, but he did it again recently.
Yeah, I mean, it was really, well, it wasn't 2016, but it was like around like when this election cycle started, since we started so early this time, like around like 2018, early 2019. But what I was going to say is that if you really start to go back into history and think about all of the issues that we have to deal with, number one, the American Osteopathic Association does not condone the use of osteopath for U.S. trained osteopathic physicians. We are osteopathic physicians.
For the record, they've been acting like a 16-year-old tweeting, yo. They have been clapping back, yo. Their tweets are mad.
They should.
They like, but you would think it'd be like, oh, well, an osteopathic physician is they're like, no, like they're like, listen, this. It's like it's pretty cool actually.
No, I mean, but this is that like liking it to it was interesting. I will never forget going to school at Ohio University when I went to medical school. I had a white colleague who had looked at me one day and said, after we were having a discussion, being in the hospital, because we both trained at Cleveland Clinic for our 3rd and 4th years, and he was like, it's quite interesting. Like, this is what it must feel like to be Black or to go to a HBCU, to go to osteopathic school. And I was like, number
DO
one,
lives matter. DO lives matter.
But it's real. But I'm like, you hope you get a taste of what we have to deal with, because not only do we have to deal with this negative bias that we are either one, did poorly on our exams or was not competitive enough to get into allopathic school, but then two, that we have limited options of only going into primary care. And I'm a proud pediatrician, general pediatrician that does academic medicine. That's what I love to do. But I had the options of everyone else, of all of our allopathic counterparts, to be able to do subspecialty work. And that's okay. But the thing is that when you have since its inception, osteopathic medicine has always had to fight within this allopathic-based, knowledgeable country that we are
Allopathic
somehow less
supremacy?
than, even though it's been proven since
Right.
this time. I mean, this is gone to the Supreme Court for us to be able to even get our rights to be considered to be fully trained physicians.
Right.
So, I mean, it's annoying.
Well, I think
the thing that,
go ahead, Dr. Ty, go in there.
no, I was just going to say, but the thing that bothers me even more, not even from an ego standpoint, there is a little ego bruising, but the thing that really bothers me is that patients or potential patients are also
That's what I'm trying to talk about.
right?
Yep. That's what I'm talking about.
And so here's what I didn't want, and that's why I put out my post and
Get
my
in this,
tweets.
Dr. Ty. Get in on this. Come on now.
No, I didn't want them to look at this and then now run to their prescription bottle or to the, because they don't really know the difference, right? And go to the the prescription or their records or whatever and go, oh my God, my doctor's a DO, I have to switch. Or maybe next week they get referred to a DO for some special, a specialist or for a surgery, and they go, well, I don't want the DO, I want the MD. And that's what I didn't want to see coming out of this, that is completely rooted in politics, right? Mm-hmm. It's just one group of folks. And I'm not saying that I agree or disagree with, what Dr. Conley is saying. I'm just saying it's clear that this conversation began because people disagreed with his politics or his stance, and then decided to drag an entire profession along with this man. And my thing is, that's great and all for debate, except for the fact that there are still patients that are not in medicine, that don't know better, that are going to just hear this and be scared, particularly vulnerable populations that are already super skeptical about the healthcare system and the treatment that they're getting.
Well, let's keep it real. Now we have to contend with the fact that not only are we DOs, but we are minority, underrepresented in medicine DOs. So you already have patients who are either come to us or referred to us who are already looking at us sideways because they're like, did you get in because of affirmative action? Or do you really know as much as your majority counterpart? But then add in the fact that now that you're an osteopathic physician, it's like, well, damn, you was even so bad that you couldn't even, you had to, I mean, that's the type of connotation. This is why I've been tweeting about it like crazy.
I'm interested because I'm going to ask you, Dr. Jen, to chime in on this. So Cher, I looked up some tweets. I've been looking through people's Twitter mentions and so Cher jumped in on this. And she said, Trump was standing on balcony at White House, gasping for air. Don't know about you, but I'm brimming over with confidence. P.S. Dr. Conley, the president's doctor, is an osteopath. I think you mentioned that, Tyree, like that's not the term that the AOA wants us to use. An osteopath, not a COVID specialist or internist. He's an osteopath. He's half step above Doogie Howser. Now I'm interested because it seems like the connotation or the definition is what people are getting hung up on for the most part, right? Like one person is an MD, whereas another person is an osteopath, right? Like, is it all about the branding? Is it the name that's the issue? Like, I really hope the AOA is listening because it'd be really interesting for them to understand what we think about how we can do this better, if there is a way to make it better. Dr. Jen, what do you think?
No, I mean, those are all really good questions, and I think it's likely a lot of things. History, branding. I mean, you name it. I don't think there's just one thing. I just know it's really disappointing, and I agree with Dr. Ty and Dr. Tyree. I agree with both everybody here. I just I think the thing that's got me most disappointed, and I am with you all with everything else, is, you know, in this day and age, I think I was disappointed at how quickly people ran with a rumor, with an assumption, with sort of an inappropriate or wrong fact without like doing a Google search. Again, I'm sorry, I'm stuck on it, right? New York Times, CNN, all of these really smart people, and yeah, MSNBC, the list goes on. David Gergen, who I respect a lot, I remember I was watching the TV, it's just a couple of months ago. It was during COVID. I was watching the TV and literally my mouth hung open. When I say it's disappointing, it's hard for me to really get over that. And so I don't know if these are myths that have been perpetuated over the years and people have assumed that the myth is correct. I don't know if it's that they just don't know what an osteopath is, so they assume it means that we're not doctors. Therefore, you know, again, is it a branding problem or this problem? I mean, I think it's a lot of issues. I just, you know, in this day and age, especially with COVID, a lot of the stuff that we deal with is misinformation. I mean, even before COVID, right? What's the number one thing that reason why people won't get a flu shot is they say it gives them the flu. I mean, we deal with misinformation on a basic level every single day as physicians, just trying to give people vaccines, trying to convince them vaccines don't cause autism, or the flu shot won't get you the flu. And it just seems like this is sort of on that scale of the misinformation we deal with times a million, because now the misinformation has to do with our very profession, the very thing that we do to help keep people safe. And I don't know, it's just, I actually felt like it set us back, 100 years. I just felt like, wow, one article, one tweet, a tweet here or there, I just felt like it set us back potentially. So, I don't know. I don't know that I provided any answers, just really expressing my disgust, and it's just a shame,
So here's my takeaway part from it as well, which is I'm looking at it as in 2015, I was part of this, Dr. Jim was part of this, of the national branding campaign that the AOA had. I mean, it went everywhere, right? It went on O Magazine, it went on Time, it was in billboards all over the country that talked about osteopathic medicine. But I feel like
wait, give us what exactly that advertisement was. What did they do?
So there was a national branding campaign from the AOA that highlighted roughly about 15. The initial cohort was 9 of us, and then there was additional DOs that was real DOs who were practicing that were highlighted and placed in national publications, on billboards across the country, that highlighted not only the different specialties that we did, so all the way from family medicine to orthopedic surgery to OB, but also it allowed for us to go into different venues or different media that most people who make the medical decisions in the home, which is typically going to be the 25 to 55, I think, or 50-year-old woman, push. So Parent Circle, and like I said before, O Magazine, all these different venues. But after that, there was dead silence. We stopped pushing that campaign. And that's one of the things that I feel like we have to get ahead of. Part of this, yes,
AOA, are you listening?
Definitely. Well, part of this is definitely, and I do not by any means condone what Lawrence Donnelly and what Rachel Maddow and all these other folks have did, because Dr. Jen is correct. They could have did a simple Google search. But I also think that we as a profession, and I'm not only blaming the AOA, because a lot of us know of so many osteopathic physicians who have walked away from the AOA, who have latched on to organizations like NMA and AMA, and have went on to, because we have been quote unquote accepted, and now a lot of our allopathic organizations, that we've walked away from our roots. We walked away from the initial group. So now when we have things like this that come up, who do we go to fight for? We just can't blame the AOA when the AOA is like, we've been here, but where have our members gone? And that's what I think we really need to focus on too, real talk.
Okay, all right.
Well, I think also people, go ahead. I was just gonna say that I think you have a really good point. And I think that, so how I felt about physicians in the health space and like, medical communication space and stuff like that is I've always felt like we need as many doctors as possible talking about health. If anybody should be talking about health and wellness, it is physicians and healthcare providers, not people who are not, which we get a lot of that. And the same thing here. I agree that as DOs, we should be talking about our profession. Now, look, we don't want to have to do it retroactively, kind of like this, and do damage control. And we don't want situations to happen where we have to rise up and speak out. But this is a good situation and a good example where, we have a voice. And whether it's just posting a small article about what really a DO is, reposting something from doctorsthatdo.org, saying, hey, I'm a DO and this is what it means to me, or anything. I mean, look, everybody has a different style, a different way of doing things, but we do have a voice. And social media, you don't have to be on TV to spread a message. And I wish that more DOs, more doctors would be in media, number one, but I also wish more DOs, especially at times like this, and basically consistently throughout the year, we would speak up, because we have to speak up for ourselves in addition to our organizations and other things.
No,
so,
Dr. Tyeese, let me say something. Yes. Dr. Tyeese and Dr. Jen, like y'all been on or continue to be on national TV, the Oz Show, CNN, let's say Fox News, so many different news outlets. Dr. Tyeese here in the New York, New Jersey tri-state area on NBC News. Like, has that ever come up when like you are like talking to executive producers and they're saying
came up today? Excuse me for interrupting, but I was on the Doctors today.
Okay, all right, let's do it.
An episode aired on the Doctors today, and my designation was MD. And I don't know how that happened. It's happened a few times on the Dr. Oz show. It's happened. It was taped. It aired.
Okay,
it is what it is. And what else? Yeah, if a segment's taped, it aired. There's no way to fix that in real time. Even if it's live, there's usually no way to fix that in real time. So other than putting a post and saying, "Hey, I was mistakenly referred to as an MD. I'm a DO." But that type of stuff happens a lot. Or people, when they're introducing me, they'll say, Dr. Jennifer Caudle from Rowan University School of Osteopathic. They're reading the teleprompter and they get to the word osteopathic, and we're not expecting it, or either not familiar with it, or it doesn't roll off their tongue. They stumble over it. That happens millions of times. Dr. Ty, I know you've got stories as well, but that just happened to me today on the Doctors. And it says Dr. Jen Caudle, MD, not DO. So.
Yeah, that's happened to me in a lot of different spaces, actually. News and different boards or speaking engagements, because they don't ask. And then if they ask, obviously I'd say I'm a DO, but it doesn't even cross my mind. And then I'm like, oh, I became an MD today, or it's on like my meeting tag or whatever the case may be. Definitely, I think it's, so it just brings up a lot of thoughts that I have about this, both that you just asked about, Nia, and also that Jen brought up earlier, is that I do agree. I think that at the core of this is that people don't really understand the medical structure at all. Yeah. Let's be real. And I think this is just another symptom of that, right? So you alluded to a little bit earlier, Nia, about how they were like, oh, well, he's not an internist, he's not a COVID specialist, he's actually an emergency medicine physician, like me, right? And so I actually had a response to that as well, because I just feel like people make up in their mind what every specialty does, right? They have an idea of what a nurse practitioner is. They have an idea what a physician assistant is. My PA friends are like, could you please tell people that we are not just assisting you and handing you stuff, like we're actually seeing patients, right? Like every aspect of medicine to some degree feels this from some other group where they're misunderstood. And I just think it's another symptom of the fact that people just don't understand medicine. They don't understand the different specialties. They don't know who does what. The fact that they can't fathom that an ER doc could have the knowledge and training to actually deal with an infectious disease or critical care issue. Again, it's like all the comments I kept reading, all I kept thinking was, these folks have no idea. They have no idea, right? And so I don't know how to fix that, because I feel like if we could fix that, we could also fix diabetes and high blood pressure and healthy eating, right? Because it's all kind of rooted in the same, just not understanding medicine and health, right? And so that's what it screams to me, more than anything else. And another thing that Jen was saying that I wanted to chime in on was about the whole concept of maybe like having DO on your white coat at work, or having that conversation with your patients. I will be honest, at certain points in my career, depending on where I worked or how early I was in my career, I got taught, like I forget where I worked, but I had DO on my coat, and every person asked me about it. And some of them were curious and were just like, oh, what does that stand for, right? And then we can have a conversation. But some of them didn't approach it that way. And in the ER, it's like, look, I'm meeting people for the first time. I'm giving them bad news with no relationship. It's not like they come to me every week and I've earned their trust, right? I'm telling them the worst thing on earth or the best thing on earth, and they've known me for 5 seconds. So it's a snapshot. I have to earn their trust and their respect in 10 seconds almost, right? And what I found, especially earlier in my career when I was wearing that, is that they would either be so distracted by trying to figure out what it was, or they were, or they had maybe heard something and were like, but you're not an MD. So are you like, is someone else going to see me? Do you report to a supervisor? And it's like, I'm trying to save your life here. Like, can we not have this conversation right now? So I'm being honest, and I guess what I would say to Jen's comment is that it's hard to be the lone DO somewhere sometimes, trying to educate one by one by one. Sometimes you need the power, like me saying, of like branding, right? Or like what you were talking about, Tyree. It's like sometimes you need that to back you up, because otherwise you're just by yourself in a closed room with a patient who now doesn't believe anything you're saying because they have some preconceived notion either about a DO, or they've never heard about a DO, but they just know you're not an MD. So what are you? And now I'm naked in a gown and you're standing in this room and I don't even know what you are anymore, right? And so we have to do something to support our colleagues that are in that position, because yeah, we can walk around and say, yeah, I'm going to be proud and tell everybody I'm a DO. And it sounds good until you're in that very uncomfortable situation where you're the only doc in an ER at night and someone really needs your help, but now they won't listen to you because they're forming some other opinion. And that's scary too. Not just like what I feel about it, but for their benefit, and I don't know exactly what the solution is for that.
I'm actually interested.
I think that's a really great point.
I'm really interested in all of your opinions on this one. And it's piggybacking off what Dr. Tyeese said, which is, we've gotten to the point where we've developed thick skin about this, right? Like we handle it, we move on, we've graduated, we got the qualifications. Y'all are doing amazing things, right? Y'all are all amazing doctors in your own respective rights. The people who I feel really bad for, obviously, are the medical students who are in osteopathic school, the residents, as well as people who are trying to get into medical school, right? Like they're going through this process like, okay, I'm about to go to this school. Is this what, I'm going to expect on a daily basis? Or, am I going to get, lab coat checked the entire time? So, between all three of y'all, can y'all talk to those students, the people who are going to apply, or the people who are going through this process, and let them know what's the deal, please?
Well, I'll jump in real quick to just say there was one point in my career where I carried the AOA. I don't know if they still print them. There used to be like little cards that used to say like, what's a DO? And I actually used to carry them in my pocket at one point because I was just sick of repeating the same thing over and over again. And they would ask, and I would be nice, and I would give a quick sentence, and I would say, here, you can read about it while I'll come back and you can read about while you're waiting for your results. So that's one thing. I mean, just because it's one thing for you to try to explain something, and it's another for them to say, oh, there's like printed material and there's an organization and this is a thing, right? That's one thing I would offer is find your way of explaining it that's not super uncomfortable for you, that really, that can break it down for folks, really. Because we have these ways of explaining what a DO is sometimes that I still think is too high level for the average person.
Yeah, I agree with you on that one.
And so
That's a good point.
Yeah, we got to find a way to really break it down for, the average Joe Blow so that they can really understand the difference. Because the reality is a lot of the differences are technical. They're not everyday, like everyday layman's stuff. So we have to do better about, I think, breaking it down. Like even the campaign that Dr. Jen and Dr. Tyree were in, I definitely saw it, but if I put myself in the shoes of a layman, all I'm seeing really is like, oh my God, look at that doctor, and he's a pediatrician and he looks friendly, and look at Dr. Jen, and oh, she's a woman doctor. I'm a woman, I could be a doctor, which is great. But I got to tell you, I'm not sure that everybody fully understood that this was like something akin, if they're reading it thinking like, oh, we have MDs and DOs that can take care of us. Like, I don't, you know what I mean? Like I don't think it walks them all the way down the road of like, pick a DO to be your pediatrician, pick a DO to be your family practitioner. Not, I hate when people say like, we're the same, because we're not the same, but like, these are your choices in care. I'm not sure that it fully got into their brains. Like I got it, but the average person, I'm not sure if it did that.
Dr. Tyree, what do you think? You've been involved.
I guess.
In that.
Yeah.
Dr. Jen, jump in. Come on in.
No. I'll let him. I'll let Dr. Tyree go.
So, here's the deal. I not only still work with Rowan University as an associate professor like Dr. Jen, but I'm also a residency program director. I'm also very active, just like Dr. Nee is, in terms of with recruitment for underrepresented minorities to go into medical school, with countless amount of mentees, as well as programming that has been focused on getting URM students into medical school. So the thing is that I'm a person of, I love history, and I think history has shown us time and time again how the point that you made, Dr. Tyeese, because I'm the real Dr. Ty.
We've been having a fight for over a decade.
But what Dr. Ty has said in terms of, do layman people or laypersons will understand the concept of osteopathic medicine or what is a DO. But I will say that as students, and I think we all have had this experience, whereas when I went to University of Michigan, I did not realize, even though I went to a school in a state that is heavily populated with DOs, and my family doctor, when I got older, was a DO. I didn't even know what osteopathic medicine was, even though I was seeing an osteopathic physician. But the beauty of it is that as you start to go through this process and you start to learn, I find that majority of these students, majority of these residents are coming into medicine right now and not thinking as in the past. Before, when you think about in like the 50s and the 60s, a lot of DOs were trying to hide the fact that they were DOs. Even if you look at California, University of California, Irvine, they were all grandfathered in to become MDs because California outlawed there to be osteopathic.
There's a lot of people right now who are like, University of California, Irvine used to be an osteopathic school? Like, yeah.
Exactly.
Yeah.
Look at history. So you got 50s, 60s where you had osteopathic physicians who were trying to hide who they were. They were passing, as we all are familiar with that term. But then you have like in the 70s, 80s, 90s, where you had a lot of osteopathic physicians who are like, well, why should we hide? We're just as good as MDs. And so it became a DO is equal to MD type of thing. We're just as good. To now where you see a lot of the osteopathic students and physicians who are like, not only are we just as good, but we're actually even better because we have additional training, additional skills that we can use in manual medicine to be able to help to treat, diagnose, etc. So the thing is that I have a lot more hope for the future than I have in terms of fear, because I see these osteopathic physicians and students who are coming out now who are wearing their DO-ness with a badge of honor. And I'm trying to make sure that I can still be one of those examples now moving into my mid-career that they can look at and say like, oh, every time it goes out, I purposefully, because being an AOA spokesperson, constantly always remind myself to say I'm an osteopathic pediatrician, not just a pediatrician, to be able to help to promote that. But I'll let Dr. Chen, because I know you had something.
No, I was going to agree with you. I think you said a lot of really great things. And I've noticed with students in the latter years, I gave a talk with Dr. Mike for, it was the DO Day on the Hill a few years ago. And I was telling a story about, you know, my path into osteopathic medicine, how I didn't really know much about it and some of the discrimination, et cetera. And as I was talking to students afterwards, they were like, well, no, it's not a big deal. And we don't really have that. I mean, they literally told me, well, we don't think about it that way, or we heard that happen in the past. I mean, again, I'm not saying that this is every student or every situation, but I'm with you, Dr. Tyrese, that like, I think that there is a lot of hope. And even, you know, I've been attending now for 12 years out of residency, you know, even that period of time,
scary to think
there's
about
been,
huh?
I think it is scary, but I definitely think there's some change. So I think that's a really great point. I am very hopeful about it and hopeful. And I guess I would also say, I always like to end on a positive note. Well, I'll say this at the very end. I will say about the brand campaign, I just want to correct it. I was not in the magazines like Dr. Tyree, well, the real Dr. Ty. Well, you're both Dr. Ty. So I was not in the magazines.
Jen, you about to start a beef up in this show.
So I know I'm about to start a fight. So I was on the committee, but you were actually in the magazines in Oprah and stuff, and that was really, really amazing. So I just wanted to say that. I guess the other thing is to, when I think about how we participate as DOs, and the other Dr. Ty, you're right that as DOs, sometimes it's hard to be the lone person sort of standing up for our profession. You're exactly right about that. But you know, that's what I'm hoping, is that if we all do a little something, and it doesn't have to be something big, it can just be posting an article or maybe mentioning the word osteopathic. And I'm not trying to burden people with an extra job, because we do need the help of our parent organization, the AOA and ACOM. But I mean, I guess what I'm trying to say, and what I was trying to say earlier, is that it does go a long way when, as you mentioned, the other Dr. Ty, this idea of when we stand up for our profession, the example it sets not only for our patients and for our profession, but also students. And I think that sometimes there are very small ways of doing that, even a comment on a post, anything. It doesn't have to be big and large. And I guess, you know, the final thing I have to say is, you know, as a hopeful message, I wouldn't be anything else. I went to Princeton, and just like you were at Michigan, I didn't even learn there was something called DOs until I was applying a couple of years later. Only was going to apply to MD schools, found out my family doctor all my life had been a DO. And I literally called up I think it was ACOM. I was like, who are you? Who this? You know, I mean, because you're wondering, who are these people? I love the philosophy so much. I didn't apply to any MD schools. I only applied to DO schools. I would do it again. And I guess what I want to leave students who are confused or feeling frustrated, which is how we feel, is to say, I bet most of us wouldn't do it differently. We are who we are because it's what spoke to us and what resonated with us and what made sense, and we are proud. So, you know, I guess, you know, I want to be hopeful, because I think that's really important, not just for us, but for the students and for those who are coming behind us, that it is better than it was, but it's going to continue to get better, and we're proud. You know, what else will we be?
And you know, I want to.
You guys, what do you?
Go ahead.
Sorry,
Dr. Ty.
No, I have a question for you guys. What do you guys think about, you know, kind of like you're saying, thinking about the future? You know, I still have memories of applying to residency back when there were MD residencies, right, and DO residencies, and especially in emergency medicine, depending on where you wanted to be geographically, there weren't always DO ER residencies. And so, you know, I was back in the days where folks are taking COMLEX, which is the DO boards, and then also taking step 1, step 2, you know, MD boards, just to kind of prove ourselves, right? Which honestly, I think that's where some of my anger is coming from, because it's almost triggering me back to a time period, right, where it wasn't as accepting as it feels right now. And I don't really want to go back to that space, but, you know, it was like that, you know, 15, 20 years ago. But now residencies are combined, where there's not this designation anymore of an MD residency, right? Or a DO residency per se.
Single Jeremy. Correct.
Right. So what do you guys think? Do you think that's going to help or hurt us with respect to the branding? Do you think it's going to help or hurt us with respect to this hope for the future?
Assistant PD, take it.
Yeah, I was going to say, it's funny because the last year was the first year, or this past match was the first match that it was a single match. So the single accreditation of the ACGME occurred around 2015. And so you had between 2015 to 2020 if you wanted to still continue on with your residency program, you were only an AOA accredited residency program to apply to become an ACGME program. Now that you have the ACGME programs, all of us are being ACGME programs, you do have something that's called the ORT, or the osteopathic recognized track. So you can still do that, but for the most part, everything at this point in time is ACGME. Now with that being said, like I said before, last year was the first time you had a single match. So for those who don't know, the match used to be in two parts. It used to be a match for osteopathic residency programs or AOA approved residency programs, and then a match for ACGME. They were usually about a month apart. And the thing is that you couldn't cross over between the two. So say, for instance, you had a choice of 5 residency programs you wanted to go to. 2 were AOA accredited, 3 were ACGME. You had to pick the AOA programs first if you wanted to have a chance to apply into those programs, because that match was before the ACGME. And if you matched in that part, you were taken away. You couldn't do the ACGME. Now that it was a single match, a lot of our students, osteopathic students, flipped out. And the reason why they flipped out, because they said, well, oh my God, now that all the programs are part of the ACGME and MDs can apply to all of these programs that initially only osteopathic physicians could apply to, now we're going to lose out. And so it turned into a huge kind of like fiasco / just panic mode. But what
they felt like the osteopathic programs were protective for them. It was like a place they knew they could go.
They thought that osteopathic programs were going to immediately take allopathic residents because of what you had said, which is, oh, I have to take the step 1 USMLE, and I have to take Comlex, blah, 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 blah. But what you don't realize is a couple of things. One, you have so many osteopathic physicians who are integrated into those ACGME programs. I was trained at a dually accredited program. So I was boarded on the ACGME side, AOA side. I'm a program director of an ACGME program. So why would I not want to pick you or to discard you? That's the first thing. Second thing is what a lot of students didn't recognize or understand is in international medical students, especially who are US citizens, are starting to increase in number. You are seeing more and more what we call IMGs that are entering into the match now. And so when you think about the desirables, as some people may call them, or your pedigree, a lot of times programs want to recruit somebody who is US trained and a US graduate or a US citizen, because you don't want to have to deal with the issues of having visas and everything else that come along the way. IMG's candidates, you don't necessarily know if you have to have those issues. So a lot of times, most programs will say, I'd rather take an allopathic or osteopathic US trained student than to take an internationally IMG student. So this past match, 95% of all osteopathic students who matched within their first top 3 choices.
Okay.
That's crazy. So you have to think about it.
Great.
That is the things that, like Tyeese, like you said, not trying to put you on the spot, but that's the things that perpetuate, because you had a lot of the old school or folks who are like us, who all the people on this call
PTSD.
right now,
Yeah.
all have that issue, right?
Yes.
Because
let's be real. There were residency programs that would not interview me.
Oh, I know.
Because they never had a deal in the history of their program.
Right.
And I wasn't about to be the first.
Seattle Children's would not interview me because I did not take the USMLE. And was lucky enough to have a mentor who told me, if they don't want to take your boards, they don't want to take your degree. So why do you want to go to them? And I matched to the program that was ranked better than Cincinnati Children's. So Seattle Children's. So it's like you see how.
What's the name of the program that you ranked at, that you went to?
Oh, Nationwide Children's Hospital.
Absolutely. Absolutely. So I wanted to finish off by just saying that, I think Dr. Tyree, thank you for explaining that whole concept of the combined match and what the studies are actually showing with osteopathic students as well as allopathic students, and some of the fears that we're concerned about obviously is not playing out, right, which is a great thing. And just overall, just what we're doing amazing things. I want the students and the medical students to understand that. I guess for me, the one thing that I felt really hopeful is I saw a lot of MDs actually standing up and really deciding to clap back and jumping on our back for that. That was really cool, I thought. So for the allopaths out there. Yeah, patient. Yeah, I saw
some
patients
were like, hey, my doctor's a DO. Like, shut up.
Yeah. So I was really appreciative about that, because I wanted to keep this on a positive end. I think from the AOA perspective, I think the things that I would say is this is a new time. This is a new age. They got to embrace new ways to stay relevant, right? We already know what's going on with the AMA, right? Like, in order to stay relevant, you have to embrace different ways, reach different people, meet people where they're at. Some people may be on podcasts. Some people may be on different forms of social media, on TV. So my big advice for the AOA is just holla at Docs Outside the Box if you want to sponsor this show. You know what I'm saying? Because we do things a little bit differently. But listen, this is real. Like I think we're starting to realize that people consume media, people get information in a different way, and just kind of just focusing on one thing, which may be print media or TV, is something that we have to consider doing other things. So that's where I want to leave it at, is just saying that, one, we're doing great things. Two, I really appreciate the entire medical community coming up and having our backs for the most part.
Yeah.
And three, we just got to consider different ways to get that messaging out. And I just want to thank you all for, one, the amazing things that you all are doing in your respective fields. Two, I just want to thank y'all for coming on the show. I know this is pretty late that we're recording this, but I think, whether you're an MD or a DO or someone who's just listening to our show, who's a professional, which actually we get a lot of just professionals who just want to know what's going on. I just want to say, thank you for your time, y'all. I really appreciate it.
Absolutely. Thanks for having us.
Welcome. Thanks for letting me vent.
Well, that's what we do on Topics Outside the Box, y'all. So.